A chronic disease is technically an incurable disease. It means that you've got it for life and that it can only be controlled through the use of drugs. Well, the statistics at the moment are that 40% of the population in Western countries have a chronic disease. That's across all age groups, not just in the older populations, but in the young generation as well. And I think that figure is set to rise by up to 50% in the next 10 years. Well, there's two main factors that we can actually look at where there's been a massive change over the last 50 years. That's chemical toxicity, that's in the environment, the food that we eat, including all the preservatives and additives and the pesticides, agricultural chemicals, and there's depletion in the food chain. So we're looking at deeper mineral deficiencies, and the change in what we eat. So there's a much higher ratio of processed food, sugars, fructose. All of those things have unbalanced I believe, the constitution and led to this chronic degeneration in our health. Well, I think most treatments that are available tend to deal with what I call the disease potential. So they will just address how that disease is occurring in the body, the symptoms. What dietary healing does is it addresses the healing potential. That means you're changing fundamental conditions at cell level, you're restoring the cellular environment so the body can start to heal itself. As the healing potential rises, that in turn sees a decrease in the disease potential, and that's what we're generating. It's a raising of the inherent vitality. Well, basically, the cell needs oxygen to function, and it needs nutrients, so something like glucose. When you get that combination, the cell will burn that as fuel, and the output will be stored as energy, or ATP. When that occurs, the ATP changes the electrical conductivity within the cell, and it encourages the uptake and what we call adsorption of potassium along specific sites of proteins. It also uncovers the protein backbone, which allows water to adsorb. So you get a very structured cell that doesn't enable sodium to actually dissolve in that structure. So it preferentially takes up potassium over sodium. Yes, the tissues have been measured using MRI technology, which looks at the electrical state of the cell, and they found that when a cell is damaged or poisoned, that indeed it does lose potassium and take up sodium, and then the cell becomes unstructured, so the water molecules fall apart, if you like, and ATP isn't generated. What they found was when they bombarded the cell with potassium, as we do on the Gerson therapy with the juices and the additional potassium, that it forced some of these binding sites to take up the potassium, and with that it kick-started the cell back into life. So yes, it has been observed that that is actually what does occur. Well, there's several things that will occur. You will notice an increase in vitality, so there'll be greater energy, and you should start to see some of the symptoms reduce. So you can start seeing signs of healing occurring. The other things that will occur, you can also get symptoms of the body releasing toxins. Now, sometimes patients confuse that with the disease process getting worse. That has to be properly managed, and that's what the book really takes the patient on a journey. So it shows them what they need to do, how to interpret their case, but also how to manage the toxins when they're being released, and not to misinterpret those signs. There are many, many other diets on the market, and a lot of them will manipulate things like blood results, or there's different testing machines. So invariably a patient will go, they'll have some form of test, or it could be a blood result, so they say there's a high cholesterol. Then they'll be put on a diet, it might be a high protein, low carbohydrate diet, which will actually bring that cholesterol down or change some marker in the blood. What you're actually monitoring is the blood test and not the patient. It's a very different thing. The patient may not feel any better going on that diet. They may actually feel worse, they may feel less vitality, their liver may be struggling more, but the blood test indicates something quite different. So the practitioner may be very pleased, oh yes, the cholesterol's coming down, but the patient's saying, but these symptoms have got worse. So you're looking at actually the overall outcome, not the blood test. It's, am I healing on all levels? And you're also looking at the risks of certain diets. So a high protein, low carbohydrate diet could lead to osteoporosis or bowel cancer, which is far worse than having a slightly elevated cholesterol level. The approach that I'm taking has been clinically proven to work over the last 60, 70 years. I've got hundreds of patients who've regained their health on this program. But really, quite simply speaking, if you cut sugar and salt out of your diet, you're going to start improving. If you take that doesn't mean to say that you're going to heal, but you're going to improve. Your blood pressure will go down, you might lose weight. If you then go that one step further, where you're putting the high potassium, low sodium approach in, you're actually going to make those fundamental changes at cell level, and you're going to start to see the body restore itself and reverse those symptoms of disease.